Hello everyone, I'm Dr. Prithviraj Deshmukh, Orthopaedic surgeon, Orthobiologic experts and pain management specialist at Nexus Day Surgery Center. Today I would like to tell you about a unique case of chronic non-healing wound and its repair and regeneration. So we had a patient who was 90-year-old and he had a chronic non-healing wound over his left heel since last almost 5 years. And the thing is, as the patient was also a known case of diabetes, hypertension, he was also suffering from transverse myelitis, hence he had weakness in the lower limb, he had diminished sensations in the lower limb, and the wound was completely infected, the bone was exposed, there was pus discharge and wound was foul smelling, and the patient had this wound since last 5 years. Patient consulted many doctors and was eventually advised that keeping his age in mind and the progression of infection, he was advised to ampute his foot to stop the further progression of the infection. But the patient was already 90 years old and he didn't want to go for the amputation. So he approached me at the Nexus Day Surgery Center. I decided to operate him under the local anesthesia. It was a risk as there was very diminished supply to the lower limb, hence even the healing or the prognosis of the surgery was uncertain. But still, on the request of the patient, I honed on to my specialty, that is the regenerative medicine, and I tried to treat the patient with the debridement surgery. After debridement surgery, the wound even increased in size and more of the bone was exposed. After the few sessions of dressing after the debridement surgery, it was the time when we resorted to the autologous conditioned plasma. And we injected around the periphery and even the center of the wound, and we repeated this procedure every week for at least 3 times. As you can see, the bone was completely covered with the healthy granulation tissues. Initially, the wound was completely infected, but as you see, after the 3rd dose of the autologous conditioned plasma, the bone was completely covered with the healthy pink granulation tissue. And I would like to tell you, all this thing happened in the span of just 2 months. After that, the skin closure was the biggest challenge for us, as the patient was again not fit for the surgery or to undergo the skin grafting. Hence, we resorted to the old method of the scarring the peripheral wound margins. And we also clubbed this procedure with the autologous conditioned plasma, and the results were remarkable. The patient showed the epidermis formation and the scarring tissue formation at a very high rate, and you can see the wound has started contracting. All these things would have been impossible if you would have seen the first image of the patient, and now you can see how the patient is on his way towards the recovery. And all this thing happened in just span of 4 to 5 months. And this was all possible because of the best infrastructure at the Nexus Day Surgery Center, where they have extensive inventory of the orthobiologics, where the people or surgeons like me can come and practice the regenerative medicine and pain management specialty with the best infrastructure provided by the Arthrex company. I'm glad to be the part of it. Thank you.